Dr. Robert Glatter is an emergency physician at Lenox Hill Hospital in New York. He joins me now. Thank you, Doctor.
My pleasure.
Dr. Glatter, the U.S. has struggled, to say the least, to vaccinate Americans at the rate promised by the Trump administration. What do you believe is behind the delay?
Well, I think we're talking about the lack of a coordinated national strategy. And, this actually began with testing, extended to PPE, and now what we have is, a situation with vaccine rollout. It's concerning. The issue is that states normally coordinate with the federal government at the level of public health departments. And this is where the coordination happens. And without that intricate relationship, that coordination, we're almost doomed to failure. And so what we've seen so far is a lack of this rollout because of the lack of communication. Also the lack of money, which we're seeing now actually come in with Congress appropriating. But, this could have been done much sooner, much earlier. We needed a plan in place to have the situation where people could get vaccine in their arm and not just having vaccines in warehouses. And that really is what it comes down to.
On Monday, Novavax announced its coronavirus vaccine candidate is entering phase 3 of its clinical trials, marking the 5th vaccine to reach the final stage in the U.S. So how does this one differ from the Pfizer and Moderna vaccines, which are already available?
Sure. This is what we call a protein-based vaccine, whereas the Pfizer and Moderna rely on other technologies such as viral RNA or actually like mRNA technology. And so the body basically recognizes the protein that is produced by Novavax's vaccine, and then it's able to churn out basically an antibody to the spike protein. And this is a novel method in that it uses an adjuvant, which is a stimulation to the immune system, along with the actual particle itself that has specialized technology that the immune system recognizes. And so the difference is essentially a vaccine that has really been around the technology for quite a while. For example, we've used this type of technology to produce hepatitis vaccines, as well as the vaccine for shingles. And so the public may have a little bit better trust in this. What's also interesting, however, is that they use moth cells as factories to produce this protein, or what we call an antigen that the body responds to. So this is novel technology, and it's been tested extensively in the laboratory, and it is safe.
The latest count is that there are more than 121,000 Americans hospitalized with COVID-19 across the country. Now, New York, as you know, was the first epicenter of the coronavirus pandemic. What are you seeing on the front lines now following the holidays?
Well, especially in my practice, we're still seeing patients come in, and obviously many of them have traveled, and the concern is that they're continuing to travel. The country needs to realize that we're in the midst of a pandemic, and that traveling really for leisure at this time is something that we're trying to discourage. It's something that people have to understand, that it's very dangerous to just go on pleasure trips right now to visit friends or family for the holidays. We need to stay home. We need to be careful if we get together. We should stay really in very small groups, generally under 10, and stay with our pod or our family, especially as the New Year's approaches. We don't want to go to large gatherings, large events. It's so important to have masking that's in place, distancing, and really with the New Year's upcoming, we really are in a situation that could be very dangerous. We're just recovering from the Thanksgiving surge, really. This is what we're seeing now in the hospitals. But really, the month of January is going to be exceedingly dangerous, and we're expecting this really to be a significant wave of patients arriving.
You make that point very clearly, but there's not a lot of anger or passion in your voice when you say it. What advice do you have for people who are thinking about traveling with friends and family to celebrate New Year's?
Really, people should stay home, stay in their pod, do not travel. I cannot stress this enough. When people travel, the virus travels. It's as simple as that. We really need to stay home. Certainly, our pods or our families, our households are really where the safest area is at this point. I'm not saying not to go outside, go for a walk and to get some exercise, but certainly if you do that, wear a mask and remember to stay apart from other people. We have to have exceedingly due diligence now, invest now so the virus does not spread much greater at this point.
Well said, and I hope people are listening and following your advice. Dr. Robert Glatter, thank you very much.
My pleasure. Thank you.